your starting salary will be around no extra expense unless you party a lot.
In a decent locality, you
Well.
might.
So, hello.
Hello.
So today we'll answer the most requested question: salaries expense. Quick video, all the details you need to know. Let's start. So as a junior doctor, like once you are here and you start, if you are starting as a junior most level, your starting salary will be around 3.3 to 3.5 lakhs Indian rupees, and it can increase when you increase your level. Like if you are a PHO level, then it can be like 4 5 lakhs, and if you're a consultant, then it can be like 11 lakh 10 to 11 lakhs per month. So it's your basic salary. And once you are working here, your usual working hours are around 38 hours a week. So sometimes you do overtime, and sometimes you do public holidays or night duties. And whenever you are working on the special occasions like these, then your basic salary, like if it is $50 per hour, they pay you almost 1.5 times to double for 1 hour. So if you are usually on a regular weekdays, you are earning $50 for 1 hour, and then you are doing a duty on Sunday, then they pay you $100 for 1 hour. So that's how you earn. So basically the basic salary is 3 to 3.5 lakhs, and after doing some extra work and stuff, you earn a lot more than that. And after tax deduction and stuff, in hand salary will be almost same as your basic salary without doing too much of efforts. Like don't if you don't want to do extra works, too many working hours, then you will be earning easily 3 to 3.5 lakhs in hand after tax deduction. So that's about working hours and salary expense.
Yeah, thank you. So how about we discuss about the leaves before we move on to the expenses?
Yeah.
Okay, so at least in Queensland Health, we get 5 weeks of paid leave, which is pretty good. Now, let me clarify, these 5 weeks can be taken the way you want. If you want to take all the 5 weeks together, you can do that. Or you can take 2 weeks and then you can take 3 weeks later on. The only thing that is required, at least in most of the hospitals, is that you let your medical workforce know at least 6 weeks in advance before you're planning to take your recreational leaves. So you have 5 weeks of recreational leave, you have some sick leaves. It can vary hospital to hospital,
But I think it's unlimited, no?
It's around 10.
Okay.
10 paid sick leaves. Then obviously if you're not feeling well, then you can discuss with your department, with the workforce, and they will come with a suitable solution for you. Maybe a couple of more days of paid leaves, maybe unlimited amount of unpaid leaves. So this is very flexible. So we have rec leaves, sick leaves. Then some hospitals do offer leaves for your professional development. If you're going to attend a course or if you're going to sit an exam that's needed for your training, they can provide you leave for that. Now, besides all these leaves, you are meant to be working, as you discussed, you're meant to be working only a couple of hours per week. Usually it's around 38 hours a week, and the rest of the time you're going to be off. So those are your leaves too.
Yeah.
So usually you're looking at a 5-day working week, and 2 days, which might or might not be a weekend, will be off for you. So that's all about leaves. Now expenses, personally I feel this is a very, very variable topic. It's subjective because not everybody's expenses and not everybody's priorities are the same, but we can give you a slight idea about the expenses here in Queensland. Now, if you were to rent a property, let's say a basic property, okay, we are looking at a 1 bed 1 bath kind of property. I would say in a decent locality, you might have to pay somewhere around 450 to 550 a week. and these are just increasing every day. So maybe by the time you arrive here, the rent is going to be higher than that. So that's the basic property. It's quite high, I would say. Then the other expense that we look at are groceries. That again can be very variable, but let's say for a single person, for a week, it might come up to, I would say,
Not very much, like $50 maybe.
just groceries, yeah, maybe 75
Yeah,
for a week.
Yeah.
It wouldn't be
It's
more than
not
that.
not much.
Yeah, it's not. I don't think fruits and vegetables are expensive here. I think
Yeah,
when
almost
compared
same,
to the UK, fruits and vegetables are much better here and they're not that expensive.
And if you compare with India, it's the like see, we have these avocados. These are cheaper than India. Yeah.
Yeah.
So-
Okay, that happened to be kept there somehow. Yeah. So that's all about
Oh, that's
expenses.
something like traveling. Petrol rates are same as India, so not much, and no extra expense unless you party a lot.
Yeah.
Yeah,
That's gonna be
that's your
expensive.
personal expense, not the basic necessity.
Yeah, you will be paying for other things like your health insurance, your
Yeah.
medical indemnity, your car insurance. So these are the things that
Electricity, water is not much.
Yeah.
So basically, you save 2/3 of your salary after spending.
if you're just spending for basic things,
Basic
you
things.
know, like your rent, your food, your transportation, and maybe let's say twice outing in a month, then you might be saving about 2/3 of your
Yeah.
salary.
So basically, if you are getting like 3 to 3.5 lakhs in hand, you are almost saving 2 lakhs out of those 3 lakhs. So yeah.
Then again, before people, come out at us and say that's not even possible, this will vary depending
Yeah.
on your personal circumstances. There might be some months where you don't
Yeah.
save anything because
Yeah.
you might be investing in something important.
Yeah, because
So,
I have seen
yeah.
people living in apartments with like 250 per week to 350 per week as well, and
Yeah.
1,000 per week as well.
Yeah.
So it's your personal preference.
Yeah, now that we're talking about apartments, there are some options where you can live in a sharing
Yeah.
accommodation where you'll have a separate room, but you'll be sharing a kitchen with somebody, or you might be sharing the washroom with somebody. And those accommodations are definitely cheaper than
Yeah.
getting your own place. So there are options available out there. There are cheaper options and there are expensive ones. It just depends what you want from life.
Yeah, and when you move to Australia, the healthcare system and your hospital, they provide you relocation charges that are around 1.25 lakh for your flight tickets, for your taxis and everything.
Yeah.
They'll provide you accommodation depending where it varies from hospital to hospital. They can give you for 1 month of accommodation, 3 months of accommodation, varies a lot. And they'll also give you some taxi passes because when you start you don't have a car, so they'll also give you some coupons so that you can travel easily.
Yeah, these
So
are some of the
perks
things
of
that
working in.
Yeah, these are some of the things that we received from our hospitals when
Yeah.
we joined. Yeah.
And your consultants pay for your coffee as well. so it's good. You come here and you start working. When you start, if in the starting salary is good, your expenses are normal. You save and then you invest, and every year your salary is increasing. Even if your designation is same, your salary will be increased.
Yeah.
So it's a good thing.
Yeah, and just before we end, it's not really always about the money. It's more about your lifestyle and how you feel at your workplace. So I think if you're feeling comfortable, happy, and you're growing and learning every day in a non-toxic environment, that really means something.
Yeah.
Yeah.
All the best.